Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. There's a mob here, Dr. Mencia.
Yes,
what are you doing here? I mean, we have a whole crowd, your own audience?
Yes, all these beautiful ladies.
And so did you just pick them up? They were walking on the street and you said they're beautiful and why don't you come with me?
Yeah, no, they used to dance in Las Vegas, and I said, why don't you just come to Florida? I get you a job, you know.
But tell us who these people are.
Doreen is the executive manager for the company, for AGI, so she supervises both offices.
The dental department.
Right.
Good morning.
Good morning. So wait a minute. Let's get all these beautiful women, get this whole room all, excited. Even the room is shaking. Let me just tell from my perspective.
And then Suzanne is the hygienist.
We have our hygienist, and then of course we have our the lady that keeps everything going, the dental office manager, right? We have everybody here.
And Michelle.
Yeah, Michelle, right.
Sweet Michelle with her beautiful smile.
Well, it makes a difference, when people come into a dentist's office. But Dr. Mencia, this was a dream of yours. We did this once before, but, most physicians don't have dental offices, and you know that.
Right.
I mean, they send everybody to the dentist.
And
but what made you do this? I know that your wife, of course, that initiated it.
Right, right. When we relocated here to South Florida, me and Dr. Rosemary, my wife, I told her, and she was working with another dentist, and I told her what my dream was, and I even had a little design of how this would be. And we really moved forward with the medical side. And dental, we just have dental general dentists. We didn't even have hygienists at the beginning, nothing like that. And then at one point, I said, wait a second. If I have done so well with all the consultant in the medical, and the patient loved that, why they wouldn't love the same thing in the dental? So we started bringing the other consultant in the dental department, bringing the hygienist. Suzanne is one of my senior hygienists in the company. And now we have a group that attend to the mouth and a group that attend to the rest of the body on the health side. And we could have filled the room with the other hygienists and the other dentists. But Michelle and Doreen are the brain behind the whole work. They coordinate everything. They handle the staff. And their job is basically maintain a pleasant atmosphere 6 days a week and make sure the patient is never neglected. Sometimes you go to a dental office and, most dental offices, they have TV. So they put a TV on and you spend hours there watching TV. And I look at this, I say, well, I wouldn't want to do that. If I'm going to watch TV, I'd rather be home, put on my shorts, get a glass of wine, something to munch on and watch TV. Why do I want to sit in a cold dental office to watch TV? So we move basically with the same concept we move down in the medical office. To us, I don't care if you are 19 years old or you are 99 years old. Time is precious. And especially for the elderly, to be sitting too long in a chair is not proper, it's not fair. So we have moved that concept. We have moved that out of the formula. Patient don't wait, patient come in, we take care of them, and let them go and do whatever they have to do.
Well, the other part about this, too, is I know that when you go to dental offices, they have the same glass that they have downstairs with your physicians. Right. You don't get a chance to get to them, but now you're a concierge style.
Right. Exactly.
Everything is open, and it's the same thing with the dentist. When you walk up there, it is so beautiful. It's like a spa almost, really, your dental offices. And you can really, from my perspective, I really hate to go to a place that is not open like yours. And I don't know where all that started from years ago. But the one thing I do really appreciate is when I go up to your beautiful second floor, at least in the commercial building where it's on commercial. And you see this elegant, the beautiful glass doors. And so already you feel a lot of confidence. You feel, well, they know what they're doing.
And class.
Yeah, confidence and class, 2 C's, very good.
Right.
And I know when Michelle is there, and she is very, very sweet, and it's important because people do come nervous. And Michelle can allay all those fears. And then, of course, we have Suzanne that's watching over everything, right? As he said, though, something you said to me before. Doreen. I'm sorry. That's right. I've got Suzanne's our dental hygienist. Too many women here.
I'm happy.
I don't know how you keep them all straight.
And Anita Finley, don't forget.
Right.
I have 4 women in here.
Let's go back to Doreen a minute. So, Doreen, you hit a very important part before we started the show. People don't even want to go near the dentist because they don't have money, they don't have insurance, and that's it. I can't pay for it.
Right. We have great payment plans in the office. You could pay as low as $50 a month. So patients, they're scared to go to the dentist. They haven't been to the dentist in 10 years because they think it's very expensive. But like I said, we have really great payment plans in the office.
And you also make them feel very comfortable.
Absolutely.
You manage what that whole situation is, don't you?
Absolutely. We never leave the patient alone in the room. We sit with them. We talk with them. We build a rapport. We don't leave them in there watching TV. We sit with them, offer them water, coffee, and
talk about their problems. They want to just come there and talk.
And when they leave, they hug you. They like us. They feel like, oh my God, this is not a normal dental office. You treated me like a human.
Yeah,
I feel like you're part of my family now. Well, that's a great feeling when someone says that.
Well, Dr. Mencia, this is who he is. This is the problem. They always say it starts at the top, and that's what I've noticed. If something isn't right, no matter how skilled someone is, if Dr. Mencia doesn't see you treating someone right, that's it.
Oh yeah.
You get your marching orders, walking orders out. No, because that's been his whole, modus operandi, as they say.
I tell you, I'm so blessed to be able to work together because we have accomplished so much. And I tell you, just yesterday we had a young female patient who, thank God, is an ex now, we can say, ex-drug addict. So she has no vein to be found. And we look from her feet and her upper extremity, both arms. We couldn't find a vein to put her to sleep, to do sedation.
Really?
And so Ted and I, the anesthesiologist, we say, okay, let's give her some gas so she can dose it out. And once the person is giving gas that put you to sleep, the vein tends to dilate. So they dilated, and we were able to find a vein and give her full anesthetic, so that we can do. And it was a simple extraction, but she has a lot of fear of dentists, but due to her addiction, we cannot. It's hard to find a vein. So these are the situations where the anesthesia department, the medical department, and the dental department are all working together to pull out one teeth, but to make sure that we do it successfully and the least traumatic possible.
Yeah, that's a perfect point of what I was saying. It does take someone like this. And I know you want to comment on this, Michelle. I'm sorry, right? Michelle, we're gonna give you the microphone because you're very cute, but you don't get to just be here and be cute. You have to talk. This is a talk show, right?
Yes. Well, there's a lot of patients that are really nervous to come into the dental practice because of their past experience when they were younger, and they're scared to come they had a bad experience in the past. So we try to get the patient to come into the office, and we explain to them what they need in details. For me, it's very important for the patients to know exactly what they need and the reason and the cost from it. And I explain to the patients, we have the IV sedation. We also have the oral sedation. And I like to explain in details to the patient exactly what they need and communicate with them and kind of show them and explain, so they can acknowledge what they need and that they have a complete understanding of what they need. I also explain to them, a lot of patients don't know that all these work that they need, like decay, gum disease, and all this, is very bad for your health. It's bad for your heart. And a lot of patients and people don't know that out there. So that, for me, is very important to let the patient know that.
So you're an educator.
Yes, I love to educate every single patient. That's, for me, is very important. Because a lot of patients, they don't know that, all these things is also a health issue as well.
Okay, so I have a question. So the next day after someone has had all this, this work, does someone call them to see how they are?
Absolutely.
Yes, we do.
See,
Oh, yeah.
Yes, we follow up with every single patient that had a procedure the night before, and we make sure that they're doing good. If they have any issues that we have, they can call us. We're on the calls. We call them
24
immediately,
hours.
24 hours.
And the dentist gives them a call too that night.
Yes,
like if they had a huge procedure with Ted under sedation, or they just had a really big experience, big procedure done with the dentist, she'll call them at night to see how they're doing.
That's
Yes.
lovely.
And they call us the next day and they're
lovely.
like, "Oh my God, I can't believe
Yes.
Dr. Mencia, Dr. Rosemary Mencia called us." I never saw that in my
Yes.
life. Oh, and Suzanne does a good job. At the end of the day, Suzanne
Yes.
calls all the patients that came in for gum treatment. She calls them all.
Yeah,
Yes.
that's really
Yeah.
that's really fabulous. Well, let's get back, I think, to being a hygienist. It's really a very exciting idea. There are a lot of universities that you can go and do this. I think a 2-year course to do this, and
For
then
the dental hygiene?
yes, dental
It's,
hygienist.
It's 4 years.
4
but it's
years.
2 years of your basic courses, like your sciences, math, English, the basic associate in science degree classes.
Mm-hmm.
And then it's 2 more years of actual hygiene school. So really, if you do the whole total from day one, it's 4 years.
And
So it's a big commitment.
so
yes.
Dr. Mencia always seems to have interns coming for
Yes.
his medical. Do you have
Yes.
interns coming for your dental? Not yet. Maybe that's a
Not
whole
yet,
new
but
thing,
that's
Dr.
a
Mencia.
good idea.
That
Yes.
is a good idea.
Ha-ha! So
Yeah.
they see?
Yeah.
And something always happens on our show,
Absolutely.
right? I would think it might be a good thing for the
It's a-
It is.
Nova has a school and all. And
Yes.
Right.
It would be nice for
We've
the
had some dental assistants. We've never had a hygienist, though.
But we have some of the dental
But
assistant
we've had some dental
students.
assistants that come to.
But I would think a
Hours.
hygienist, isn't that
Yeah,
as
of
important?
course. Yes.
Or
Yeah.
we've had some assistants that have come to observe or help out just right out of school, and they've come into my operatory and they've said, could I watch you for an hour? And I said, of course you can, because they've also kind of insinuated maybe I want to become a hygienist down the line. So, and I don't mind that at all. I'm happy for them to watch. Absolutely.
Well,
And
Dr.
Suzanne,
Mencia, you're-
Suzanne will be a great mentor because she's been doing this for over 25
She said
years. She has
that.
a lot of experience, in the field.
I'm going to tell you about dental hygienists, and it's interesting that some of them cause pain. Throughout the years, I've gone to various places, and it's unfortunate because then the dentist loses patients.
Yes,
because a
absolutely.
dental hygienist
Absolutely.
can make or break that
Yes.
patient. Do you agree, Dr. Mencia?
Absolutely.
And
Absolutely.
you've heard that?
And the hygienist, I see the hygienist in dentistry like I see the dietitian in medicine. They spend a lot more time with the patient. They bound. There's a lot of hygienists that when they leave you, the patient will follow them. They say, "Oh no, this is my hygiene." They really
that's
make
true.
a bound.
Yes.
It's not like a dentist. A dentist usually they go in, and you have a cavity. We're gonna fix this, or we have to do an extraction. Maybe an implant that's gonna be a long process. Then the bounding between dentist and patient come in. So a lot of time they are more bound to Doreen or Michelle than to one of the dentists there. They are okay with the dentist, leaving. Oh, I'm relocating. They're okay with that. But it's your staff there permanently. And that's what we have. We have a stable staff. And the hygienists become an integral part of that staff because of the fact they spend so much time together with the patient. that they really get to trust the patient. They get to know the patient better than any other personnel in the professional side of the dental department.
That's a good point.
Yes,
that is
it
true.
is
You do
very
make
true.
friends.
You have a lot of patients that followed you from different offices.
I do have
Quite a
patients that have followed me.
You're like the psychologist, right? They're in there. And,
Right, right.
You're there for a good hour, and so
And this is because patients that have I worked somewhere for 10 years a very long time ago when I moved up to Fort Lauderdale from Coconut Grove. There was a big handful of patients that tried the new hygienist there, and it's not the
It
same.
doesn't feel the same.
And it all came to being thorough and being pain free, which like we just discussed, that really I know a hygienist can break or make the practice, or any member of the team,
Right.
because one slight thing can be a big turnoff, or the biggest thing is to be pain free to the patient,
Right.
because the dentist is not a comfortable, natural place to begin with. So there's always a fair, even if they don't have a bad experience.
I'll tell you.
One
Go
of the
ahead.
things that Michelle and Doreen can elaborate on, they have a huddle every day before they start their day. So why don't you guys talk about that?
The huddle.
Yeah, we go over each patient, what they need.
Like a team.
Yeah.
The whole team is there.
What they're going to
great.
have,
Yes.
if they have pending treatment. So if they have pending treatment, so the doctor could educate them, the dental assistant could educate them, Michelle, Suzanne, me, we could educate. So they hear it like 4 times before they leave.
Yeah, we have a great communication with the team.
Yeah.
And we like to talk about every patient and what they need. And, we're ready for when the patients come. We try to have everything ready so the patients don't have to wait.
Smooth.
The patients don't have to wait, and we always try to, we are on time with everything. And for me, the great thing is the communication with, with the team and also with the patients. Build that bonding with the patient, have them trust you so that they can, feel comfortable. They want to come back to the office, and I think to me that's very important.
It is, and let me just give some information now. So let's talk about Dr. Mencia and his, of course, medical practice. And he's been in commercial for a long time on Commercial Boulevard, and now, of course, they opened on Hagen Ranch Road. But the new thing is he's going to be there twice a month in
Twice a
Hagen,
month.
right? Oh
Yes.
boy! And of course, you have a dental practice there also.
Exactly.
And but let's just give a phone number to call in Broward County at the on Commercial Boulevard, because that's the one that's his major office, and that's 954-489-1345. That's 954-489-1345. And the dental department is open on Saturdays, right?
Yes.
Yes,
Yes.
yes, we
Said that
are.
to me.
Every Saturday.
Every
So
Saturday.
that's really important. I will tell you once. I had an experience. I once went to a dentist, and it was a long time ago, and the dentist was very nice, but the hygienist was really good. And then she left, and another person came, and somehow someone never taught her how to use the water, and I was drenched. And I don't know about that, but it was the funniest thing. She,
Cavitron.
the water.
Yes,
I mean,
Cavitron.
Yeah.
I mean, I
happened.
just got wet all over, and it was, I don't know what happened. I never went back.
Yeah, that is not good.
Yeah.
Bad
I mean,
experience.
Yeah, that's not good. We don't
So
want
are you
that.
trained in using all this equipment?
Absolutely. I'm very good with using the Cavitron. But
Yeah.
yes. The hand scalers, the Cavitron, everything. So there shouldn't be water all over your face. No.
Yeah. She's
My face
trained.
went down my neck. It was
Not be.
He
Yes,
goes
Suzanne's
like,
been
oh,
cleaning
thank you
teeth
for the
over 10
shower.
years. No.
Thank
The
you
other
for the
thing,
shower.
I think you told me something. Wait, just a minute. I think you also told me something, and I'm very careful. About that when you're taking X-rays and you use the whether they put on it, but you
Yeah.
put it up over your throat.
Thyroid, yeah,
Thyroid,
because we
yes.
want to protect
you
the
should
thyroid
really
gland.
tell people, because I don't think everyone does that.
Right. It's important to protect the thyroid gland, for
So you have to ask. If you're not going to Dr. Mencia's office, make sure you ask for it to go up over your, thyroid, right?
And you want to let your hygienist know if you're pregnant or anything like that, because they can still, proceed, especially if you are planning to become pregnant. For the younger, listener that we have, it's so important to get a very thorough cleaning for your teeth before you become pregnant.
Why is that?
Well, same thing we say about the heart. Same principle. If you have bad oral care and you start brushing your teeth while you are pregnant, you can have a miscarriage. You can lose the fetus.
Oh,
It
that's
would be pregnancy gingivitis.
Oh my goodness!
Which I have patients, and I tell them that when you are pregnant, or you're trying to get pregnant, or especially when you are pregnant, the hormones, if there's plaque there, bacteria that's causing the gingivitis, it's going to be emphasized. So it's really important to make sure your mouth is, plaque free.
Well, we have a lot of older listeners who have grandchildren, and they're going to tell them. I heard on Dr. Mencia's show, that's what they say all the time. Yeah. That, did you get your teeth taken care of? Because we don't think about that when they go to the baby, to go to the gynecologist and all, and the obstetrician, right? Now you got to go to the dentist, too. Get your teeth checked.
Right.
Yes, you do.
And, Suzanne, one other question I think is important to clear for the audience out there. Because you'd be amazed how many people have insurance that cover your service 100%.
Yes.
And they don't use it.
Yes.
They don't use that.
Yes, a cleaning, that's right.
Let's say a person at risk of losing, a smoker, at risk of losing their teeth, a drug user. How often does that person need to get a cleaning versus a person that have no risk at all?
So someone that has minimal plaque, no recession, no history of gum disease, that person is getting something called a cleaning called a prophy, which is a very simple cleaning and a polish. I'm going to say the majority of patients happen to fall into the type of cleaning that needs a little bit more than that, because the older you do get, over time, and it depends on many things, your medications, if your teeth are crooked or straight, if your oral hygiene habits at home, your diet, all combined together, your saliva, if you have too little, too much, which can be hereditary or from medications. But so it's not just one factor that has me let the patient know they need to come 3 months, 4 months, 6 months, the occasional once a year when they're really excellent in oral hygiene. But there's another cleaning called a perio maintenance or full mouth debridement, which a lot of my patients need. Sometimes they just need that to get back into a 6 months, or they need to come in sooner or get the deep cleaning done to prevent any further gum disease. So a patient like that is usually coming like every 3 to 4 months because they have to, because they're predisposed to having the gum disease, and it's harder for them to take care of their teeth. It's just more work for them.
And that's really so important, especially for the baby boomers and the and then the elderly patient.
Yes.
That they are taking medication, and they come to the medical side and they say, I'm having a lot of oral problem. Why is that? And we look at the medication list, and they might have been taking medication that produce dryness of the mouth.
Correct.
And sometimes it's the other way around. Sometimes I say the patient that they come to me, they don't make the correlation. They say, it's a medical doctor. Why should I complain about my teeth? So when they are a new patient and they come in, and I look at the medication, that the patient is taking, then I go to the mouth, because I say, oh my God, you're taking 3 medications that can give you dryness of the mouth. Right. Open your mouth, let me take a pic, and no, you go into the dental department, and we give a free consultation.
Yeah, well, you brought up a very good point about someone having more serious problems. It isn't just they go, but you're talking about gingivitis. You're talking about a lot of other things. Their gums.
Right.
And they can lose their teeth. And then maybe in the next section, as we get into our next half an hour, we're going to talk about what we're going to do when someone does have something serious like that, because now we can get into dental implants. We can talk about some of the other things with that, okay? Yes. So we'll be...
we can talk about deep cleaning versus superficial cleaning.
That's what we're going to do. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.